that we face in this very unusual time that we're experiencing. I'm going to be covering 5 related topics in the webinar. The webinar presentation will be about 40 minutes, and that will leave us lots of time, 20 minutes, for discussion, and you can use your chat function to send questions, and I'll do my best to get through those questions. The first topic I want to cover is the challenges and the opportunities, and I emphasize opportunities, that COVID-19 is presenting many organizations. And as part of addressing the challenges and really seizing the opportunities, it's really important to think about how organizations can become resilient, and to look at resilience as a way that organizations are able to build the capabilities they need to really move forward and to find a sustainable path out of the pandemic and into some kind of new normal. I'm going to be talking about, in some detail, the concept of resilience, but also a much broader concept that is called psychological capital. More on that to come, but I think you'll find it particularly useful, those of you in the educational sector, and it does have some parallels with the concept of professional capital that people like Hargraves and Fullen have written about specifically for the educational sector. And finally, I want to touch on the links between resilience as a set of skills that you can develop and a transformational leadership style, and how transformational leadership really is going to be more essential than ever as organizations try to plot a path forward really into an unknown future. So let's begin and look at the damage that COVID-19 has caused. One U.S. economist quipped that this pandemic basically has put the economy into a medically induced coma. And certainly from Statistics Canada's reports, we know in this country that means that the GDP in the last quarter is down about 40%. We know that 4 out of 10 workers are now engaged in remote work of some time, either full-time or part-time, working from home. And we know that 2 out of 10 Canadian workers are basically out of the labor market. So this is a huge, serious economic impact. But at the same time, it is presenting some opportunities to actually rethink the way we go about working. Just to give you an indication of that, last week, one of the fairly large tech companies in Canada called OpenText, based in Waterloo, Ontario, announced that it had been monitoring their employees as they are working from home, and discovered that this was something that many of them wanted to continue doing. So they announced that they were basically closing basically shutting down half their office space, and going to keep many of their employees engaged in their work in a virtual manner. So this is a huge shift. When we look at the way that COVID-19 is really transforming our economic and social lives, The Economist magazine, which is a pretty astute observer of economic and social trends, says that out of this, there's going to be 3 huge changes. Deglobalization, as what were once global supply chains are going to be looking for ways to become more localized. Second, big corporations are going to grow stronger, and all you have to do is look at the huge jump in Netflix subscriptions, the fact that Amazon is out hiring 100,000 new workers. I mean, the list goes on and on. We know that some organizations are clearly benefiting from this and have adapted very well. And the third trend is the wider spread of digital services. Now, what's interesting here is just this morning on CBC News, there was the announcement that a number of large Canadian universities have decided that their fall terms are going to go digital. And this, for the universities in this country, is a huge shift in how they go about teaching, moving from a bricks and mortar classroom approach to running their courses essentially online. So this is part of what's being transformed. But I would argue that there's actually a fourth trend here, and that fourth trend is how we are going to be changing our work practices and norms. Again, another example in the news today, Starbucks has announced in Canada that it's going to be opening 85% of its outlets by the end of May. Well, to do that, they basically have to rejig the entire service process in a Starbucks cafe. So that's changing how people work for sure. That's only one small example. There's a huge paradox in the impact that the pandemic has had on how people work. Now, the image on the left side of the screen here is a handwritten poster that some mom out there has put on her bedroom door because that's where she's working from, and she's got a conference call happening, and she's also got a couple of young school-age kids running around, and she's trying to deal with them at the same time. So this is the coping strategy. So what we know about remote work is that there was a huge demand for it and a rising demand prior to the pandemic. All kinds of surveys conducted in Canada and the United States show that a lot of Canadians would prefer to have more flexible work arrangements, and that includes remote working. In fact, there was a Gallup survey done, this is a Gallup in the US, that showed that a large percentage of millennial employees would quit their current job if they could get a full-time job working remotely. So this shows the pent-up demand. And we know from having looked at pre-pandemic remote work that people doing this are equally or more engaged. It contributes to their well-being. It certainly provides them with a higher quality of life because they're basically spending zero time commuting, and there's also lots of opportunities to work smarter. However, because of the pandemic instantly imposing homework on many organizations that had not even contemplated it prior to this March, it's created a lot of chaos. So the question there is, what can we learn? How do we look at what already exists in terms of this widespread practice and transform it quickly into a sustainable strategy? So there are opportunities, and there's definitely some interesting examples of how organizations have effectively adopted home working as a way to virtually learn, virtually collaborate, and virtually innovate. But to do that in the context of the COVID-19 pandemic, that also means acknowledging dependent care responsibilities. And there's numerous reports available. Now, again, the research on this is yet to come. What we have today to tell us what's happening is essentially a lot of anecdotes and some very good reporting by reliable media outlets that people with kids and virtual work responsibilities are having a very tough time of it. What some far-sighted employers are doing is actually monitoring those employee experiences, doing quick pulse surveys, finding out how people are coping, finding out what their psychological health looks like, and also what their childcare and homeschooling experiences are like, and trying to put all this together. It's also an opportunity to, in real time, develop resilience skills for individual employees and teams. Now, the final point I want to make on this, looking at homework as an opportunity, is if an organization handles homework well, is able to tap into how their employees are experiencing it, is able to adapt, is able to provide the support that's necessary, trust levels in the organization will go up. And that is going to be a critical enabler of successful transitioning out of the pandemic. So now I want to turn to the concept of a healthy organization. And up in the right-hand corner of this slide, that's the front cover of my new book on creating healthy organizations. And much of what I'm drawing on in the slides to come really are coming out of the book. But of course, what's new is applying the principles, the concepts of a healthy organization to the current pandemic. Now, one of the things we know about organizations is that just as we talk about resilient individuals being adaptable, agile, capable, and resilient, the same characteristics can be developed within organizations. And doing so will increase the possibility of positive outcomes for employees, for the organization itself, and for stakeholders. So for those of you who are in the educational sector, big payoffs in terms of students, parents, communities, and society. So part of the building block of a really healthy organization is its culture. And I simply talk about a positive culture, a culture that really values well-being, that infuses well-being into the way decisions are made in the organization, that gives it priority, and that recognizes that the way that people go about doing their jobs on a daily basis will really make a difference in whether they thrive or not in the workplace. So today, within the context of the pandemic, you simply can't take culture for granted. You need your culture, you need your values as those guideposts that will help get you through this difficult time. And organizations that have people-centered values will be the ones that are going to be able to, I would say, do considerably better getting through and coming out of the pandemic. And again, there are many examples. People-centered values means that, you know, in a local company it's a manufacturing company that's been running throughout the pandemic here in the Okanagan. I live in British Columbia in Kelowna. And this company, the CEO and the values are very strongly people-focused. He's been doing regular Monday morning briefings for the entire staff and working through his supervisors, and the communication has been excellent. The provision of supports for helping employees who are dealing with mental health challenges, like, for example, worried about their health, worried about their family's health, and worried about their finances, get the support that they need. So these are examples of the way that values can really focus in this tough period on helping people thrive, ensuring that they're getting the kind of support that they need in order to do their job well, but also to stay healthy. And a positive culture, now I kind of apologize for the rather cute cartoon on the left here, but it gives you the sense that the culture, really the the underpinning values that teachers are bringing to their role are going to infuse their class. It will motivate students. It'll definitely motivate other staff, and this is what leads to a much healthier educational organization. Another building block of a healthy organization is taking an inclusive approach to change. Well, what does this mean? Basically, it means that everybody in an organization can be a leader. That frontline employees, in the case for many of you, that means teachers, are really they feel empowered to find better ways to go about doing their job. And they are supported in trying to develop and implement those better ways. So a leader who is taking this inclusive approach doesn't mean you abrogate your responsibility, not at all. What you become is an enabler of others to seize opportunities. And doing so gives frontline employees, and this would apply in education as much as it does in healthcare, as much as it does in really any sector. What you're doing is giving those individuals the opportunity to become even more engaged in their work, more connected to the organization. And by providing some resilience training, which doesn't have to be a huge investment of time or money, by providing that resilience training, you will build individual and team capacity to effectively execute that change. Now, I've got a quote on this slide that I thought would be relevant for educators because it comes from Michael Fullan, who's a well-known educator. He used to be dean of the Ontario Institute for Studies in Education. He's written extensively on leadership in education. And this is a very timely quote because it does get at this idea of inclusive leadership. And what he says is that the litmus test of all leadership is whether it mobilizes people's commitment to putting their energy into actions designed to improve things. It is individual commitment, but is above all collective mobilization. So that means mobilizing the entire organization. Another concept that, in my view, is absolutely central to a truly healthy organization that views supporting well-being as a way to achieving even higher levels of performance is the concept of community. Workplaces, indeed, can feel like communities. And when a workplace feels like a community, it is definitely more caring for those who are part of that workplace. And it will feel more caring for customers, clients, students, whoever is coming into that environment. It means that employees can rely on each other. It means that everyone in the organization feels personal accountability for being a good citizen. Now, I want to point out here that organizational psychology as a field of academic research has really looked very carefully at the concept of what's called organizational citizenship. And this really speaks to the way that people are committed to making their workplace better, because everybody wins when that happens. Another feature of the workplace as a community is that it is psychologically healthy and safe. So how do you achieve this? Well, leaders definitely set the tone, but as I've said here, it's got to be a collective responsibility. And one of the ways leaders can set the tone is by creating a shared vision of a workplace as a community. Now, the image on the left, there's an interesting story here, I think, because it comes from a friend of mine here in Kelowna. He and his partner run a digital animation studio called Yeti Farm Creative. They've got 100 employees. They saw the pandemic coming early March. They provided all the technological and social supports that their employees needed to move from being in a bright new open office to working from home. But they're digital animators. They make cartoons. So you can see, this is Todd's image. This was done early in March, just as the pandemic was coming, and you can see the little toilet paper rolls because this was the time when somehow there were shortages of toilet paper everywhere. Anyway, he captured this sense of his employees being able to cope with the pandemic, but at the same time supporting each other. And you can see the way that their arms are kind of interconnected. That's the support. So that gives you, in an image that is relevant for this particular business, the sense of a community. So let's look at what resilience actually means. Now, many of you in the educational sector will be familiar with the concept of resilient kids, and there's a lot of psychological research on that. It's more recent that the concept has been applied to organizations. So a few years ago, just to highlight this, the Harvard Business Review called resilience the new leadership skill and talked about how leaders and organizations needed to become more resilient. Well, that means thriving in the face of adversity. It means bouncing forward, not bouncing back. It means bouncing forward and finding a new normal. It means being able to manage stress, adapting to change, and through the adversity you're dealing with, finding new strengths that can help you leap forward and maintain not only the kind of excellent education or other services or products that you're trying to provide, but maybe even do it better. Now, the good news about resilience is that it is a learned skill. It's something that individuals and organizations can learn through training and through mutual support. So one of the ways that I saw this happen was a few years ago, I was doing a series of workshops in New Zealand, and I had the opportunity, and it was a real eye-opener for me, to do a workshop in Christchurch, which in 2011 was totally decimated by a major earthquake. Basically, half the downtown was completely destroyed. Hundreds of people were killed. And they really grabbed onto this concept of organizational resilience and community resilience, and really talked about how this is more than just finding how you can kind of work your way through a crisis. It's really developing skill sets that will help you do better in future. So one of the recommendations I would make is to not just think about resilience building for individuals, but think about it as a team capability, something that teams as a group can develop. And here's a quote from an article out of one of the major, like really top tier occupational health publications that talks about what team resilience looks like. And basically, it's the capacity of a group of employees to manage the everyday pressures of work, remain healthy, adapt to change, and be proactive in positioning for future work challenges. And one of the things that the research, and there is quite a bit of research on this particular feature of resilience, one of the things that it tells us is that if you can develop resilient skills within your team, that team will be a higher performing team. So here's a handy checklist. This comes out of that article that I mentioned in the Journal of Occupational and Environmental Medicine. I actually have quite a discussion of this in my book on creating healthy organizations, if any of you want additional background. But what I've got here is essentially a checklist for assessing your team's resilience. And you know, basically you can, at a team meeting, you can pull this up and say, okay, let's talk about how effectively we do each of the following. Focus on continually improving how we go about our work. Do we focus our energy on where we know we can make a difference rather than just beating our heads against a wall on projects that we don't think we're going to get anywhere on? Do we have effective problem solving and decision making? Do we promote self-care, which is critical? And that links ahead to another topic I'm going to mention, which is psychological health and safety in the workplace. Do we have various ways, not just one, of developing our skills and knowledge, in other words, of learning? Do we provide positive support to each other? This is critical. Do we encourage people to feel part of a team? That's the sense of community. You can see the links to that whole concept of the workplace as a community. And do we focus on possibility, not negativity? So, you know, this you can use in a variety of ways. It has some I think, pretty clear practical applications. So now let's look at the connection with what I've just been talking about in terms of resilience and team resilience to psychological health and safety. And I'm guessing that most, if not all of you, have heard of Canada's national standard for psychological health and safety in the workplace that's been out now for 7 years. It's had really a lot of interest from employers across all industries in Canada. And really what it provides is a set of tools and resources to help help people and organizations foster psychological well-being while at the same time enhancing performance. And for the K-12 system, that means promoting respectful relationships between staff, students, and the school community. I mean, that's really a centerpiece of a psychologically healthy and safe workplace. And it also provides support. This is one of the other dimensions of the standard. It provides a lot of support for employees who are experiencing difficulty. And we know that in times of COVID-19, the stresses and the strains mean that many people are feeling psychological distress. So there's a lot of resources that are linked to the standard that can help. So here's where the standard really connects with resilience, because the standard has identified a list of 13 workplace factors that contribute to psychological health and safety, which means they contribute to people's well-being in those workplaces, and they also contribute to performance. So 9 of those 13 workplace factors have direct connection to resilience in a team and in a workforce. And quickly, those factors relate to support of managers and coworkers, values that emphasize individual well-being, skilled people leadership, respectful relations, support for employee growth and development, providing resources that enable workers to manage workloads and job demands. This is critical for managing stress. Involving employees in decisions. That is one of the key features of the inclusive approach to leadership I just spoke about. Recognizing people's contributions and providing flexibility to achieve work-life balance. Now, of course, the standard is, as I said, 7 years old, but it's interesting, this last feature is something that has become especially front and center during the pandemic, as so many people are working from home and having to juggle homeschooling along with their job. So these are, what I'm trying to do is basically connect some big dots here, make some big linkages between resilience, psychological health and safety, and the resources that are out there already and widely available for free to develop these capabilities in your organization. Now let's look at the broader concept that is, I think, very relevant, especially in the educational sector. Now, I really became well acquainted with this concept through a project I did several years ago with the Alberta School Employee Benefits Plan, known as ASEBP, and the College of Alberta School Superintendents. This was a joint project, and I did the research for the project, so I was directly involved right from start to finish. And what the project did was look at the connection between resilience and leadership. And when we were developing the sort of the methodology for the project, I brought forward this concept of psychological capital as being far more robust than simply just looking at resilience. And the educators on the team that was doing the project said, yes, absolutely. And this is where they made the connection with the concept of professional capital that was already familiar to them as educators. So psychological capital combines 4 components: resilience, confidence, optimism, and hopefulness. And there is extensive research on psychological capital. And what that research tells us is that these 4 attributes combined have a much greater positive impact on individuals' well-being, team well-being, and performance than any one of those attributes on their own. So that gives you basically a multiplier effect in terms of benefiting well-being and performance. The other interesting feature of psychological capital is that it is positively contagious. Now, I talked about this pre-pandemic, and I'm cautious using the word contagious now, but I really want to emphasize the positivity here, because what happens in an organization that's actively cultivating psychological capital is that it ripples out across the organization. So you might provide training on this to, let's say, a team of leaders, but it does ripple across the organization, or even to a work group, a frontline work group, and it will start flowing out from there. And again, to emphasize, just like I said for resilience, psychological capital can be learned. So here's what psychological capital, I'm just using the short term for it here, PsyCap, but here's what it involves. And this is, again, this checklist comes from the 3 of the leading researchers in the area. These are all psychology profs in the States, and they've developed a questionnaire that really can diagnose the level of psychological capital, and also, in very practical terms, lead to the kinds of training that could further develop these features of psychological capital. So if you just quickly scan down this checklist, what do you need in order to have this set of capabilities that I'm calling psychological capital, or that these experts call psychological capital? You look on the bright side of things in your job. You're optimistic about the future. You manage difficulties at work. You take stressful things at work in stride. You feel successful. In other words, you have a sense of accomplishment and efficacy in your work. You can think of ways to get out of a jam. You feel confident contributing to strategy discussions, and you feel confident presenting to a group of colleagues. So again, this is a tool. You can take this, print it off. These slides will be available to you after the presentation. Use it in discussions with your group, and send it around to them if you're having a virtual team meeting to talk about this. So what's also connected? So we've moved through a discussion of resilience. We've connected resilience to some of the big features of a healthy organization: the sense of community, inclusive leadership, the culture. Then we jumped to talking about psychological health and safety in the workplace, and then expanded the concept of resilience to include those other features of psychological capital. But there's a final connection I want to make, and this is absolutely critical. This goes back to the study I mentioned with the school superintendents and the SEBP in Alberta, where we could see in the research literature, and this ended up being confirmed in the survey that we conducted of school leaders in Alberta, that individuals who are strong in psychological capital are more likely to have what's called a transformational leadership style. So here we're contrasting transformational leadership, and you can see the features of transformational leadership, basically driven by a vision of a better future, supporting and enabling others to take positive actions in the workplace to make improvements and so on, acting as a coach and mentor. So this contrasts with a transactional style of management, or I hesitate to use the word leadership when talking about transactional management, but that's the contrast. And so if you're a transactional manager or leader, you focus on goals, you focus on maintaining the status quo, and the chances of anything being innovative or creative or encouraging others to take the risks needed to make improvements would be minimal. So that's the contrast here. So transformational leadership is, in the research literature, strongly connected with improved employee well-being, improved employee job performance, higher levels of innovation, collaboration, and creativity in teams. And certainly in the study that I've referenced, that I was involved in Alberta, these connections were very, very obvious. So what I'd like to do now is to summarize the points, because I've covered quite a terrain here in a short period of time, and I'd like to summarize 6 key points as takeaways for you, and I'd like to encourage you to access the slides after the presentation, look at the summary points here, but also go back and revisit any of the slides that you think are particularly relevant for your organization. And if you're if you're a principal, if you're a school superintendent, if you're in any kind of a leadership role in the educational system, I'm hoping that you can find bits and pieces of what I've presented today that can be of value as you meet virtually tomorrow, the next day, soon, with your teams, and use this to make the kind of capabilities that are going to be necessary to move in a healthy and a sustainable way out of the pandemic lockdown to a kind of, whatever's going to be the new normal. So the first point here is that the features of a healthy organization, and there's lots about this. You don't have to buy the book. There's lots about this on the website, and in fact, you can access the first 35 pages of the book for free on the website and see what the sort of the main themes are in all the chapters. And so recognizing what's important here is to recognize that the features of a healthy organization support your workforce now and will prepare it for the recovery. So that gets down to giving people opportunities to take leadership themselves, to be innovative, focusing on the values, using those values as guideposts, ensuring that your teams are supporting each other, that you've fostered this sense of community, that well-being is an important goal in and of itself, and you have the resources and the supports out there to ensure that people are able to maintain that well-being during a very difficult period. The second key point here is that resilience is one of the defining characteristics of a healthy organization. I mean, it is a healthy organization by definition is resilient. And it means that it's adaptable. It means that by supporting individuals to thrive in their jobs on a day-to-day basis and to support each other, to that sense of belonging to a team, to a community, you will have the capacity needed to move into an unknown future and to engage everybody in figuring out what that pathway should be. The third takeaway here is to recognize that resilience is not something that's kind of new and separate and different. For those of you who have been focusing on psychological health and safety, and I mean, in the educational sector, I know that this has been one of the key features of many programs you've rolled out over the last number of years. For example, looking at bullying within the school environment. Well, that's psychological health and safety writ large. So recognizing resilience as part of your efforts to create a psychologically healthy and safe educational setting is really going to make much of what I've talked about easier to do, because you're basically pulling together and integrating those what can be very, very large and daunting areas. So recognizing as well that you can by cultivating resilience within a team, you are also developing that team's psychological safety skills. That's really an important connection here as well. Fourth, recognizing that resilience, when combined with hope, confidence, and optimism, and I'm sure, without even asking, I'm sure that all of you want these features within your teams, within your workforce. That when you combine these, you are going to have certainly a more energized staff. You are going to be enabling people to really see their way to a better and a brighter future. And that's true of any organization. Fifth key point, psychological capital. So the characteristics that really define, and you can go back and look at that checklist that I provided of psychological capital. That really does encourage and support a transformational style of leadership, and it's that leadership style, for those of you who are in leadership positions within the educational sector, that is going to contribute to the well-being of your staff, the well-being of students, and the performance of your schools. And finally, I think that there are hidden in the ways that people are adapting real time to the COVID-19 pandemic. And I think of the way that truly in very, very, very short periods of time, the school system has just completely flipped itself into a virtual provider of learning. And I see this. I've got 3 grandkids in grade 2, twins in grade 5, and it's amazing what their teachers are doing virtually. These kids start their day with a 1-hour Zoom class conference call, and they've got all kinds of online resources, and they're totally engaged. So for teachers to do that means that they have really looked for opportunities within this hugely challenging time to find better ways and more innovative ways to educate kids. So looking for those sorts of opportunities in what otherwise is just a series of huge challenges is also really critical. So I want to thank you at this point for your attention. I want to encourage you to fire off your questions and your comments. And if you do want further information, and there's a lot of it for free on my website, and I would be more than happy to communicate with any of you afterwards. There's also an email address. So now to get to the questions. I'm just reading here. Thank you for focusing on thinking. Okay, now I'm just clicking where it says show question list. Okay, let's see here. Question list is not coming up. Okay. First question, how is psychological capital related difference to self-efficacy and collective efficacy? Well, yes, so that's a very good question, and there you can one of the 4 components of psychological capital, in fact, is efficacy. It's I use the word confidence, but essentially that's efficacy. So if you're looking at the connection, it's direct and strong. So thank you for that question. Okay, so I click on this. Okay. It's just taking a little bit of time for the questions to come up here. Okay. Next question. Do we only get the slides after? Okay, so there's some very practical questions here. Where do we find the slides? So maybe I could ask Benita, who has been exceptionally helpful in setting this up at the summit, the EdCan Summit, where people can access the recording of the webinar and the slides. Benita, are you able to? It looks like she's muted. So what I can suggest is that if you go to the same site where you registered for this webinar, you should be able to find the slides and the presentation there. Okay, next question. You said the first 35 pages of your book are on the website. Do I mean the EdCan website? No, it's on my website, grahamlowe.ca. And if there's a big, it's easy to navigate. There's a big picture of the book. You click on that, and there's a feature that says "Look Inside," and it'll take you to the first 35 pages. So, we're getting lots of questions. Thank you. All of a sudden, they're just flowing in here. So. Is there any certificate for this webinar? That I don't know. That's something that that the people who have organized the K-12 Workplace Wellbeing webinar series can answer, and I'm sure that they'll be getting back to you on that. So here's another question on psychological capital. Can psychological capital be lost? Or once you have, once you have it, are you protected from losing it? This is a very interesting question, and what I would say is that if the organizational conditions that support psychological capital all of a sudden disappear, you will find it very difficult to apply those skills. So it's not a matter of losing it in the way that people talk about literacy, use it or lose it, for kids or adults even. Rather, it's losing the environment that is supportive of psychological capital. So, in my consulting experience, I've seen organizations where a new CEO comes in. The CEO cleans house, hires in from the outside many new members of an executive team. This would be in the private sector where I've seen this happen, and sets an entirely different tone for the organization that really makes everybody hunker down and just be really careful about what they do. So that kind of change in environment would mean that it would be, difficult, or you'd have to be very careful about how you went about applying these skills. So I don't think you lose it. You might lose the opportunity to practice it. Okay, so there's another question here. How do you suggest we measure organizational health? Do we have questionnaires? So yes, there's in my book, there's checklists, there's a lot of practical tools about actually assessing the organizational health of your organization. There's a 25-item checklist that you can use. There's a change readiness assessment checklist to really look at how prepared your organization is to actually move forward, because for some organizations, we might be talking about some really significant and major changes. So how do you go about that? You don't just leap into it and try to do it. You need to carefully plan and navigate, and one small step at a time. Over time will do it. So there are tools. What I've been slow to do, and I'm thanking Donna for this question, because what I've been slow to do is actually put those tools up for free on the website as separate downloads, and I will do that. It might take me a day or two, but you will be able to sign on to my website, and you'll be able to get the basically the healthy organization assessment tool. Easy to use, and you can print it and use it with your team. Okay, so next question here from Max. As you know, most educators won't have the continued option to work from home. Agreed. How do you think the principals can build resilience in their schools when we all get back to school? Yes, so the presentation here is looking broadly across the entire workforce and what impacts the pandemic has had. The biggest change definitely has been virtual working, and I would say to Max, virtual learning. So one of the ways that the educational sector, I'm guessing, is already considering, what are the lessons learned, how we've adapted, is how providing online resources for students, maybe more online learning opportunities, and certainly as the universities have essentially, I mean, UBC and McGill and some others have already said, like a lot of our large enrollment classes are going to be online now. So that's a huge shift in educating, and it's a huge shift in how educators are going to have to go about doing their jobs. Now, to the specifics of your question, how can principals build resilience? You can talk about this during team meetings. There's an article. Okay, so let's get really practical here. In the December 2019 issue of Education Canada, I had an article called Resilience and Beyond. This can be downloaded from the Education Canada website and from my website, that talks about how to build resilience. And so it's short. It's actually got the psychological capital checklist and the transformational leadership checklist in the article. You can print it off, distribute it, and talk about it. So that would be a starting point. So thank you, Max. Okay, next one is this is from Trent. Is the capability to build psychological capital impacted by the level of trauma? Well, so by trauma, do you mean stress? I think I'm assuming that you're referring to the traumatic impacts of how lives have changed because of COVID-19. And I would say that, yes, that you can actually build, whether you want to just focus on resilience or whether you want to focus more broadly on psychological capital. Doing so will help people get beyond the stress and the trauma. And you will be providing them with some sense of greater control over their immediate environment, their work environment in particular, that will, I think, help them move forward. So yes, you definitely can use it to address stress, and define the trauma. That would be my first suggestion here. Is you're using the word trauma. What are the words? What's the language that your teachers on your team or in your school are using to talk about how it's impacted them? Do they talk about distress? Do they talk about worry? Do they talk about anxiety? I mean, what is the language that people are using? And that could be a stepping stone into discussing the attributes of resilience and psychological capital. So thank you, Trent. Okay, here's from Carolyn. I appreciate your insights about balancing home and school. What advice would you offer educators as both workers and parents of school-age children with recent government direction to provide live instruction while also having to balance supporting their kids? How should principals best support their staff in these circumstances? Well, really, it comes, I don't have specific answers. This is a tough challenge for sure. And I know from what I've read, what I've heard, that some teams and some team leaders, and that would include principals, have been effective in figuring out what is the art of the possible here. If you're having to work from home and if you're also having to homeschool your kids, what's working, and sharing what those practices are, what hasn't worked, what has worked, and communicating, up through the channels in the school districts, the school boards, to the ministers of education, and through that to the public health officials, the difficulties and the supports that are required to address those difficulties of really doing this incredibly, what can be incredibly stressful balancing act. What I've seen and what I've seen predicted is that people will not be returning to work full time if they are having to also look after their kids at home. And this is going to be a choice, but it also could impose financial hardship on a large number of individuals. So how do we do, how do we support people to do both? And a phased transition is clearly going to be the best way. I've read examples of organizations that are giving people, 2 or 3 days in the workplace, then several days off, so that they can deal with family and with kids. So there's different combinations. That's got to be discussed. That has to be customized to fit the particular needs of your team. And there is no standardized answer. That's for sure. So thank you. It's going to be something that we'll be watching very closely, and sharing what's worked, I think, is one of the ways that the school boards can really, by communicating right across the board what seems to be working. That could be one way to provide collective support for this. Okay, next question. Got time for, okay, here's the question from Sarah. What are some barriers to building a resilient team, i.e. training and resilient skills, implementation? Okay, so how do you do it? Well, my experience as a consultant is that one of the biggest barriers to doing any of this is time. Especially given the last question about people not only, juggling new ways of doing their work, which is teaching, but also having to homeschool kids if you're in that position. So not having time is a big one. What I've also noticed, though, is that, I've been doing a lot of webinars over the last month, and people do, so the upside is if you're working from home, you are spending zero time commuting. So that might mean you have an extra 30 or 45 minutes to engage in some kind of online team learning. So that's a way you might be able to overcome that big barrier, i.e. not enough time. Another barrier is complete lack of support from the top of the organization. And I'm talking right across all different types of organizations when I say this. However, the way that some industries are organized, and I'm thinking education here, and I'm also thinking healthcare, frontline delivery teams in healthcare have a fair bit of scope to figure out how to do things better and how to develop skills within the team to provide better patient care and support themselves. So they can take that initiative, and they're far enough away from the top of the organization that, frankly, as long as they're doing things well and even better, everybody's happy. So in the case of education, you in a school, I would think, would have some scope to take actions that are unique to your particular school, and figuring out, and again, lots of communication with teachers, figuring out what do they need, what's going to work, what are the best ways to build time for developing new skills. But first of all, making the case that these skills will be useful, and ensuring that people understand what that usefulness is going to be. Okay, so I think I've covered that, and thank you, Sarah. Now, by my watch, it's 2 minutes after 11, so I want to thank everybody for attending the webinar. I want to thank the K-12 Workplace Wellbeing webinar series, and I also want to thank all of you who have sent in questions. So great. Thank you.